Hi everyone, once again welcome back to Amar Edu videos. This is part 2 video, continuation to the previous video of understanding regulatory documents part 1. Now in this video I am going to talk about CRFs, case report forms. The case report form is an official data reporting document used in a clinical study. Its purpose is to collect the study data in a specific format that is used for efficient analysis. A CRF helps to collect relevant data in a specific format that is in accordance with the protocol. Also, the data collected in CRFs should be in compliance with the regulatory requirements. CRF helps in complete and efficient data processing, analysis as well as reporting. Now, the important point here is a protocol defines what data should be collected in a CRF. That means all data that is captured in a CRF must be specified in a protocol. Data that will not be analyzed should not be appeared in a CRF. Now, coming to CRF development process. A CRF designer, usually a CRA, in most cases initially prepares a draft CRF form from the protocol, and then a CRF review meeting will be held. The CRF review meeting will include members from different crossoovers like investigator, data manager, biostatistician, database developer, data entry person, clinical research coordinator, trial nurse, etc. All these review meeting members will provide their comments to the design of CRF. Then once again, the CRF designer addresses all these comments. After a final review, the final form of CRF will be signed off. Now here, important point to be considered is interdisciplinary review. The interdisciplinary review should be made with relevant team members of project involved in conduct. Now, coming to the structure of a CRF, there are three main elements in a CRF: the header, the safety related modules, as well as efficacy related modules. The term module indicates a group of similar or specific questions. The term CRF indicates a single CRF page. A series of CRF pages makes up a CRF book, and one CRF book is completed for each subject enrolled in a study. Coming to the header, a header must have study number, site or center number, subject identification number, etc. And in most cases, a CRF also consists of a footer that includes investigator signature, page number, version number, etc. Coming to safety modules usually include subject demographic details, vital signs, medical history, physical examination details, details of adverse events, concomitant medications, details of patient disposition, etc. etc. Now coming to efficacy modules, designing of efficacy modules depends on target drug as well as the target disease. That's why these are considered to be more unique modules and are often difficult to develop. For example, if you need to study a dose response curve for an investigational product, you need to keep track various doses given for a patient at different types. Well, here are some important considerations to keep in mind while designing a case report form. While using date and time fields in CRF, consistent format should be used. As you can see in this example, at one place they have used MMDDYY format and at another place they have used DDMMYY format. Also, it is best practice to use separate lines or boxes to enter dates in expected format, as you can see in this example. The same principle applies for fields where we need to enter numeric values like this in example. Also, you need to be more careful while using DVG boxes. What are these DVG boxes? DVG stands for discrete value group. It is a list of values that constitute acceptable responses to a question. You can assign DVG to a question to limit the allowable responses for a question. For example, DVG with the values yes or no is an appropriate form for many questions. Be consistent in using codes beside these DVG boxes. As you can see this example, there are no codes at some places while they are present at some places. Here in this example, you can see some consistency all over these boxes along with the codes. Also, wherever the tables are given, don't use codes only at the column headings as in this example. Now see this example. It's better to use like this next to the checkboxes. Also, please be careful with inconsistent codes while designing a CRF, as in this example. Also, avoid using the option check all that apply. This kind of options forces assumptions about the clinical data and it makes the database structuring unnecessarily complex. As you can see in this example, it's better to use yes or no options whenever such questions are required. Also, as you see on the screen, it's always a best practice to provide instructions just above the set of questions that helps in better understanding. It is always recommended to provide expected units to capture the data as you can see in this example. In this example, you can see 6 boxes are provided for a field called assigned study number in page 1 and 9 boxes in page 2. This raises unnecessary confusion. Even if the study number is 6 digits and if there is no need of that extra 3 boxes, it's always better to be consistent throughout the CRF book. Also, please use proper indicator questions whenever required. As you can see in this example, there is no indicator question. Now, if this entire box of adverse events is kept blank, those who are reviewing may be confused whether the subject did not experience any adverse event or the data entry person have forgot to enter. As you can see this example, there is an indicator question at the top. Did subject experience any adverse event with the options provided as yes or no. This prevents assumptions and confusions. Some other considerations to keep in mind while designing a CRF form are: please be consistent throughout in using page formats, font sizes, etc. Do not use too much or too little white space in a CRF. Choose best layout, whether it is a portrait mode or landscape mode that suits your study the best. Please be consistent in using page numbers. Either you use them or do not use them, please be consistent.